Megaplex Theater, 25th Street. So I tried COQ10 for heart health, and some preliminary studies show that it may be helpful for some conditions, but not for others. This one is from iHerb. It's 100 milligrams of fermented CoQ10. Now, CoQ10 is found naturally in meat and nuts and things like that. So it is found naturally in the diet, but if we can increase the amount that we're getting in supplements to help with heart health, then why not? I also take it in addition to the beta blocker with a regime of whole food-based vitamins. This one is by Megafood One Daily, and what I like about it is that it's made from real food, like broccoli and ground up carrots. It has boron in it, a trace mineral, and fruit phenols such as organic whole orange, organic cranberry, and organic blueberry to help with the immune system. And I am going to try the women's multi as well to see if that's any better. But they are food-based, and that's why they're so awesome, because they're made from real food, the Megafood ones. And anyway, so a 2017 study found that people who took CoQ10 and had heart failure had a 31% lower mortality rate, although there was no increase in their heart's ejection fraction or output. But however, the CoQ10 did increase exercise capacity and reduced muscle pain associated with statins. And I'm also reading this book called Heart Attack Proof by Michael Osner, MD. And here's some more benefits of CoQ10. That it decreases endothelial function. So when given to patients with coronary artery disease, CoQ10 resulted in an improvement of the function of the endothelial cells, which are the cells lining the blood vessel walls that play an important role in maintaining vascular health. CoQ10. And with heart failure, CoQ10 is important for the energy creators of our cells, the mitochondria, and they are essential for heart muscle contraction. And some studies have shown an improvement in heart pumping capacity with CoQ10, but other studies have not. So there is some skeptical, debatable, does CoQ10 help? But the things that are for sure proven to help and be benefited from CoQ10 are the muscle pain from taking statins that is reduced with CoQ10, and the 31% lower mortality rate when you take CoQ10. So those are for sure things that are documented by studies, but some things that are maybes that are helped by CoQ10 I mentioned, and some things that are for sure is that they help the cells lining the blood vessel walls and the arteries, and have a decreased mortality. They decrease mortality in people with heart failure. And some small studies have showed that they reduce chest pain, which is caused by restricted blood flow to the heart, so CoQ10 could help with that. It says some small preliminary studies according to Michael Osner, MD. Also, when it comes to heart attacks, CoQ10, when given within 3 days of a heart attack, resulted in a clinical benefit. However, that was measured, and further studies are needed, it says, before CoQ10 is routinely recommended. However, the preliminary data is promising, and CoQ10 helps with hypertension, causing a small reduction in blood pressure. So those are the ways that CoQ10 can help, and I've been trying CoQ10 as an experiment on myself for about a week now, and I have noticed decreased chest pain. I hope it's not just in my head and I'm just imagining it, but it does seem to be helping so far. A longer trial period will probably tell me whether it is or not. And it's also an anti-inflammatory agent, so it helps reduce inflammation in the body. And I get rashes on my hands for my lupus, and I haven't noticed that those are as bad lately, whether it has anything to do with the CoQ10 or it's just a coincidence. But anyway, a longer trial of this will tell. And so, yeah, I guess I'll keep trying it and see how it goes.